So it can be perplexing to have a friend or a family member that you think might be struggling with an eating problem like bulimia nervosa and to think about how to help them. I guess one of the things that you might be first wondering about is like, is there actually something going on? Does my friend or loved one have an eating problem like bulimia? And, sometimes a person that might be struggling with this is not going to be perfectly forthcoming with you that there's a problem going on. But you might start to notice things. If you're living with the person, you might start to notice that large amounts of food are going missing from the kitchen at night and seem sort of unexplained. You might notice that your friend or loved one is spending large amounts of time in the bathroom. It doesn't really make sense. Patients with bulimia will often be quite careful about trying to hide their symptoms, but sometimes there are certain things that can't be hid. Sometimes the smell that comes from the vomiting behavior can be lingering in the bathroom, and if you start to sense this on a recurrent basis and you're living with a person that's struggling with this type of problem, you might start to wonder if something's up. People with bulimia nervosa can also be doing things like using laxatives or other types of dietary supplements, and that can also be a clue that something is going on. As far as how to help the person, allowing a problem like that to go on without gently maybe trying to bring something up at some point. I think if you think something's going on, it's better to try to communicate that and have a conversation about it in a non-judgmental, gentle way, rather than sort of letting it go on under your nose without trying to address it. But people can be in various stages of readiness for change, and sometimes people that are struggling with that type of problem can be forthcoming about it when confronted or when talked to about it, and sometimes people just aren't ready to do that. But at least conveying that you have a concern and that you're willing to open a non-judgmental ear to things that might be going on with them is often as much as you can do as someone supporting a person with bulimia nervosa. Certainly, if you're a support of a friend or family member that is struggling with bulimia nervosa and has been forthcoming with you and expresses that they know that there's a problem going on, one of the most important things you can do is urge that person to try to get professional help from a mental health professional or a treatment center that has a lot of knowledge and experience with these eating problems. Sometimes the road to that person's recovery can be involving family members in a therapy, and being open to taking that journey with a patient can be another important part of how you can help someone with bulimia nervosa.